Hello, everyone. A very good evening to all of you, and a warm welcome to Dr. Manasa. I'm privileged here to be along with her, and she has actually cleared her FMG exam this time. And the score, yes, of course, the dream score of all the students, she has scored like 200 plus 201. So, welcome here, Doctor. Can
Thank
we
you,
just
sir.
have a little bit of your introduction that, like, you have completed your graduation from where,
Myself, Manasa. I'm from Kerala and I completed my medical course from Ukraine Sumi State University. So,
Mhm.
so now I'm thanking to all those who supported and helped me to achieve this goal. Thanks a lot.
That's really nice. That's really nice. So, Manasa, you said that you have actually completed from Ukraine.
Yes, sir.
So, I think that would have been a really tough time when all these things were going on, the war and all these things were going on. So, how did
Yes,
you
sir.
tackle that one?
Yes, sir. The war so affected so much me also, and also every student. I think 1 year I lost completely. Stay back from my studies due to this war. What the career also stopped. Like, and also mentally we also stressed a lot due to if we able to continue our studies or not. Like that 1 year, I think we struggled a lot due to that war.
And even after that, you have cleared your exam, and that too with like an excellent score. That is really a great thing. That is really nice. So,
Thank
Dr.
you, sir.
Manasa, can you please tell me like how did doctorals actually help you during your preparation?
Uh, Actually, I started my preparation from fourth year onwards. But due to the war, I got a post due to that war. 1 year post supposed to used to do, and after that, I think after my graduation, I again started to stay back my studies. And I think I completed almost all subject, and I used to revise every subject. I am saying that revision is the main key. Like studying one time is nothing really. Studying one time is really similar to like studying nothing. So I used to revise every notes and every watch used to watch every videos. And before the exam also, last 1 month, I think I used to completely go for revision only. I didn't study any new things. I revised my notes, my written notes, and also printed notes also. That's only I did. And
So,
giving more importance to the previous year topics, that usually came, that's repeated in every exam, not as like same questions, but every topics are repeated.
the thing that you have actually emphasized on, that is revision, like that is really really important. Like learning or studying only once is not enough, and you have to revise. So, Dr. Manasa, can you please like specify any number of revisions that you specify, or like it's common?
Revision complete subject I revised it two times only. I got the time to prepare during this last 6 months. And I
Mhm.
prioritize some topics, important topics, and that revised, I think, more than 5 times I revised the important topics.
That's really nice. That's nice. So, like normally revision in the sense learning the entire subject again, or like the things that we come up in doctor tutorial, like quick revision programs and all those will help you out, or like learning the subject entirely again.
Yes, sir. The quick revision helped me a lot because studying the whole subject, it will take a long time, and reminding it's too difficult. So quick revision is important topics, and that's helped me a lot to retain the things in my head for the exams.
Mm-hmm. Okay, like moving a little bit away from the academic part, moving towards the personal part. You
Okay,
said
sir.
that you were like mentally disturbed a lot because of all the situation, and even not only mentally, even like studies were not all happening. You have to take a complete break in the middle. Then
Yes, sir.
how did you cope up with that one? I just want to like know that part. How do you come out of that one? It was
I
happening fine. Like, yeah.
Yes, I think because my studies that I started before that helped me to achieve this. If it got a break, and I think that during the med school I studied a lot. Maybe that helped me to achieve or regain that power after a 1 year break. Also, I think
Mhm.
so.
So that's an important message that we are actually conveying to all the students who are preparing for June exam, that starting early is the main important thing. So two things what Dr. Manasa is actually trying to tell us is that starting early, and yes, of course, the revisions plays a very important role, and of course the quick revision program that we have done at Doctorals helps a lot, you know. Apart from that, Dr. Manasa, like what is your because you have just completed the exam just now, like freshly, you have like fresh experience.
Yes,
We
sir.
faculties will be always saying, students have become like, ye to bolte hi rehte hain, they'll be keep on saying, hai na. So you have just completed your exam freshly right now. So what is your suggestion that you want to give to the students going to attend the June exam?
Mhm. I'm saying to everyone that those who are studying, the things you should study should be revised many times. As much you can revise that, do that only. That you don't make any mistake from the things that you studied. Like it will be, the questions will be more confusing. So don't make mistakes from the things that we studied. So make sure of that and start your preparation early and as soon as possible, and don't waste any of your time, because every time is precious and important for you. So start to as soon as possible and utilize every time.
That's nice. That's nice. So, based on the current scenario, current trend that is going on, I'll ask you like two questions. Number one,
Yes.
like writing the notes yourself is very much important, or following the Xerox notes is important?
Myself, in my experience, writing our own note is important, but I think it will be useful if we started early, because in the late stage it will not be useful and we will not get that time to do that.
Okay.
For the
Question.
for the early starters, I think written notes is useful. And
Okay. Second question, and one more very important thing which is going on nowadays, according to the present scenario, present trend. Will you suggest learning like one-liners or the conceptual things?
I suggest conception only, because studying one liner or studying it mug up or by heart, it's not enough. Understanding the concept is really important.
That's nice. That's nice. Fine. So one last and final thing, like the moment you got your result today, you saw your result today. Like, what was your first reaction, and how did you
Um,
present it to your parents actually?
First reaction, I really didn't expected this much. I think during the grand test, I used to score this much, around 200 something. But as the exam, after the exam, I felt it's some kind of difficult for me, because I made so many silly mistake that I from the non my study from the my study topics, I made so many mistakes. So I felt a little bit less confidence after the exam, but the result really, I think result really excited me.
That's nice. That's nice. Okay. How about your parents now? Like, did you meet
Yeah,
them? Inform them?
yeah, yeah. I met them. They are also so much happy.
That's really nice. I think you have given them the best gift today. And after all this 5, 6 years of struggle and all this, ups and downs in life, you have given them a very, very nice gift. So, Dr. Mansa, once more, congratulations to you. And then God bless you with lots and lots of success in your life. May you keep on succeeding like this in your life. So, my dear doctors, the take home message after interacting with Dr. Manasa, who has recently cleared the exam with such a tremendous score of 201, the take home message is that please start early. And then number two, yes, making your own notes is very much important when you're starting early. And yes, of course, the quick revision program that we have done at DocTutorials at the end, that is very much useful for you people to revise the subject before going to the exam. And Dr. Mansa. And I think
Yes,
this
sir.
is like a very motivational thing. After speaking to you, I'm getting that even after so much hurdles, even after so many things happening in life, ups and downs, you have made it. So congratulations, doctor. God bless you. God bless you with a lot of success.
Thank you,
Thank you.
sir.
Thank you. Thank you, Chief. So what? So Mansa,
Yes, sir.
I think the team has finished this one. Hello, is there anyone available from the team?